Hello, everyone. My name is Kadija Ferryman. I am a cultural anthropologist by training and a professor of ethics and technology at NYU's Tandon School of Engineering. The title of my talk today is Race Matters in Oncology Apps. Even though this is a virtual talk, I'd like to begin with a land acknowledgement. I ask you to join me in acknowledging the Lenape community on whose land I reside, which is now referred to as New York City. Land acknowledgements demonstrate a commitment to working to dismantle the ongoing legacies of settler colonialism. I also want to briefly mention my disclosures. I'm a professor at NYU, a member of the National Institutes of Health's All of Us Research Program Institutional Review Board, and have received funding in the past from the Robert Wood Johnson Foundation. I'm also a member of the American Anthropological Association. So the title of today's talk is Race Matters in Oncology Apps. I will briefly raise and address these questions. 1, does race matter in oncology apps? How? 2, where do we see race and racism manifest in oncology apps? And 3, how do we address race and racism in oncology apps? Before we deal with race matters in oncology apps, we have to mention that race matters for cancer, specifically for disease diagnoses and outcomes. This infographic from the National Cancer Institute shows that racialized minority groups in the United States are more likely to be diagnosed with and die from many major cancers. For example, African American women are more likely to die than white women from breast cancer. And research shows that much of these disparities are due to social factors, including racism and other forms of marginalization, rather than innate biological differences. So how does race matter in oncology apps? First, we can think about how race matters when it comes to representation of images of people with cancer. Research by Marilyn Alacock and colleagues shows that a lack of visual representation of Black people in cancer images translated to lower perceived relevance of the disease. And this here on the slide is an excerpt from the study done by Alacock and colleagues, where one of the informants explained that not seeing images of Black people with cancer really made this person feel like cancer was not a relevant disease for them. And when we look at the oncology app Living With by pharmaceutical giant Pfizer, we see a stark lack of visual representation. Only white appearing people appear as one scrolls down on the website for the app. It would seem from these images that only white people are living with cancer, which is of course not the case. But this lack of visual representation in this app can have real impacts here, just as the research above argues that a lack of diversity in images can lead to a perceived lack of relevance of cancer, especially among marginalized groups. Living With is an app that illustrates the erasure of Black and other racialized groups as populations who are bearing the burden of cancer and should have tools to help them manage their disease. In addition to a lack of visual representation, race matters when we consider data representation. Using data analytics such as machine learning with health data has shown that a lack of images of dark skin can bias these tools in favor of those with light skin. This lack of data representation means that automated diagnostic tools, which could be used in apps to diagnose cancer, would not work as well for Black people and others with dark skin. To address this lack of images of dark skin, there's a grassroots and social media hosted effort called Brown Skin Matters. This Instagram feed serves as a resource of images of dermatological conditions in people with dark skin. This resource can be used to help make diagnoses, as well as diagnostic tools powered by image data, more fair and equitable. So race matters in visual representation in cancer apps, and race matters when data that can power apps are not representative. But there's also a more pervasive, more invisible, and thus potentially more harmful way that race matters for oncology apps in racial correction. The article Hidden in Plain Sight, published this year, examines the use of racial correction in clinical algorithms. The authors show that racial correction happens in multiple specialties, including oncology. And this image here is just an excerpt of the larger table that the authors provide of the use of racial correction in multiple specialties. Race correction entails adjustments of clinical measurements and/or algorithms and risk calculators depending on the race of the patient. And we see that some of these corrections are based on outdated and in some cases explicitly racist ideas about Black bodies. And what makes these corrections even more pernicious is not just that they are often invisible and unknown to even clinical practitioners, but how they might influence the care given to racialized minority groups. If we focus just on race correction in ontology, as this excerpt of the table here shows, we see that one major risk calculator for breast cancer lowers the risk estimate for all non-white patients. This may lead to decreased surveillance of these patients, despite the racial disparities in cancer outcomes. With this in mind, we must consider how risk calculators, which are embedded in apps such as these, perpetuate the notion of reduced risk, and in turn can have negative impacts on the care that marginalized people receive. The Hidden in Plain Sight article brings light to the questions that have been raised by clinicians and others, and there seems to be an increasing awareness and critical reflection about the use of racial correction in medicine. Recently, Mass General and the Brigham Hospitals announced that they will no longer use racial correction for eGFR, a kidney function test. But Dr. Alice Falk on Twitter here, this excerpt from Twitter, raises the question that is pertinent for our consideration of oncology apps. Will app developers follow suit? Will app developers no longer use racial correction in the development of their apps? One example of an oncology app that does not use racial correction is the American Society of Colposcopy and Cervical Pathologies app, which screens for cervical cancers. And this app is the #2 paid app in the medical category on the App Store. The research that powers this app uses the ASCCP guidelines, which state that different groups in the US, despite differences such as socioeconomic differences, have the same overall level of risk. 2 years ago, I teamed up with physician Robert Wynn to write an opinion piece in the Cancer Letter on how AI can entrench health disparities. Our recommendations included prioritizing health equity in AI development and ensuring that data do not perpetuate advantages for white people and disadvantages for racialized groups. The same recommendations hold for oncology app development. Oncology apps can feature people of color, especially Black people, prominently in their app visuals, as well as include marginalized communities in the design of these apps. So one can imagine that living with cancer might be different for a Black woman, might be different for someone from a Native American community, especially due to the cancer disparities that are so largely present. Also, it is important to ensure that data used to power these apps are representative and would be evaluated for explicit and implicit, sometimes invisible, racial bias and discrimination, such as the use of racial correction. Equally important is prioritizing health equity in the design of oncology apps. In other words, oncology app development would prioritize addressing the health disparities that were mentioned earlier. When we recognize that race matters in oncology apps, we begin to see how these tools might be put in the service of health equity. Here are my references, and thank you very much, and I look forward to questions.